everyone, this is Mommy Needs a Minute. It has been a very, very hot minute. This last year has been very trying for me and Abigail, but because, it's always good to air out all the laundry, I decided to tell you guys what the experience was for me when I actually did go through my heart surgery. Because a lot of times when I have a discussion with someone and they're telling my stories, I bring up the fact that I ended up having open heart surgery at 28 years old, and it was because they didn't find that I had a heart problem when I was a baby. So then, lo and behold, we get into this large story of what actually happened. But I thought it would be interesting to see it as a point of view video, just because there is a lot of medical stuff going on in our family. I figure it's one way that we can start with something, and then as things go down the line, we'll be able to explain a little bit more how things are going otherwise. So, the name of this video is I had open heart surgery when I was 28 years old, and I went blind. Yep, you heard that right. I went blind for 3 days. So I will explain that, and I also, on top of that, had to learn how to talk again. So this is quite interesting for me, which I was never expecting, so I'm going to explain it a little bit. So, going back about a month after me and David had gotten married, which was July 30th of 2016, so Abby would have been about 6 months old. I went to the hospital for chest pain. So I've gone to the hospital for chest pain before, wasn't thinking anything of it. Lo and behold, we figured, okay, hey, whatever, they're just going to send me home. Nope. They come to find out at this point that my heart at 28 years old was 3 times the size on the right hand side. So lo and behold, I was a real life Grinch. My heart had grown 3 sizes. So they then from there sent me to the cardiac person, or cardiologist in the Darton General. And then he sent me over to Halifax to the Q2, where I still, on a yearly basis right now, deal with the congenital heart clinic. It was then told to me that I had a condition called PAPVC, which stands for partial anomalous pulmonary vein connection. So essentially, one of the main arteries I had in my heart was actually going up more towards my neck, and it wasn't in the right place. So it actually wasn't properly taking the blood that was oxidated when it went to my lungs to the rest of my body. So a lot of people were quite surprised I had managed to, in all reality, survive this long. So I got to take him, and I did explain long. Because when I was growing up and I was a kid, I did the cadet program and different things like this, and I was never able to withhold the fitness standards of what I should have been able to for my age. And yes, I was still a little, had a little bit of chunk in the trunk, but still, at my age, I still should have been able to keep up with the rest of my, cadets. And I wasn't able to. I was only ever able to just skim by the crease of my blush to get the bronze level of fitness. And I always thought that maybe that was just, that was just me. But going back to the lot of problems I've had over the years, comes back to the fact that it explains my heart problems. Now, since we've later on in life understood what actually happened. So, once I went to the Q2 and they actually explained to me what this program or what this problem was, so I went from cardiologist to cardiac surgeon who actually deals with congenital surgeries. If anyone's not aware, a congenital issue means that you were born with it, and it means that usually people that have congenital serious issues like this usually have it handled when they're like infants, toddlers at the most. Mine wasn't found until I was 28 years old. So I talked to this congenital heart surgeon, and he then took on my case because it is a problem I have had since birth, so he decided to take me on as his patient. He then went on to inform me that if I hadn't had this surgery done when I did, looking at me at 28 years old with 2 children and a 6-month-old, that if I hadn't had this surgery that they needed to do, which is called the Warden's procedure, by the time I was 30, I'd be looking at heart failure or stroke. So, of course, as any 28-year-old would do, I became very upset because I'm like, what the hell am I going to do? Like, this is not something you're expecting. I'm a brand new baby, blah, 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 blah. You know, kind of made a breakdown. But then he's like, the earliest thing that you for surgery is next Friday, which was June 17th of 2017. Because as soon as they found my heart problem, everything happened within 6 months before they got me into surgery, but it all happened within a 6-month period with all the doctors and everything else leading up to it. So, lo and behold, a week later, after I got this news, I am getting ready to pre-op. So this is where my POV really starts. So I had to be there at like 5:30 in the morning because, you know, they have to go through all the normal pre-op procedures. My mom and my stepdad were there. My husband David was there. My best friend Julie of over 16 years was there, and another good friend of me and my husband's, Alan, was there. I was sitting there with them. They were getting me ready for pre-op. They were all kind of sitting around and whatever like that, just kind of trying to sit there with me at 5 o'clock in the morning. And then everything kind of hit me of what was going on and how serious the surgery was. So then I started taking a major anxiety attack. At this moment, when I started taking the major anxiety attack, the nurse is in the process of giving me something for anxiety, and then that's when the amnesia started. Apparently, to my parents, my friends, my husband, after they gave me the anxiety medication, I was awake until the entire time when I went into OR. But right from the moment that she gave me the medication, I don't remember a damn thing. So yeah. So then I went into surgery. They told my husband they were maybe only able to do like maybe a small incision, and I'd probably be over a couple hours. Lo and behold, it ended up being almost 12 hours in there, and they ran into a couple different complications. So even before I managed to get to the recovery room, they had fixed what they need to with the Warden's procedure. They took me off the heart and lung machine, and I had sprung a leak. So they had to put me back on the heart and lung machine, and then fix the leak. And then they found a hole in my heart. So then they had to fix that. And then as time went by, this is going longer and longer and longer. So then when I finally came out of recovery and I was in my room, most people, when they start to wake up, you know, they're usually groggy, sore, typical thing, right? No, I woke up with the intubation tube still in my throat, and I wasn't supposed to be waking up with the intubation tube in my throat. So I started to choke to death. And one of my other good friends who lives in New Brunswick had to tell the nurse to come and help me because I was choking. So then they put me back under enough until they could get the intubation tube out for me to come back around. Now this is when I started noticing a problem. So, when you usually wake up from surgery, you can usually see your family and, you know, everything seems okay. It's just like, you know, again, you're sore, you're groggy and whatever like that. But I opened my eyes and I was blind. I couldn't see anybody. It was all dark. The only thing I could hear, believe it or not, was people's voices. And I'm lucky enough that the people that have been in my life that care about me enough that I've been able to register whose voice belongs to who. But I essentially was blind for 2 days. Gradually, as the days went on, I started to be able to see shapes and shadows. There was one point when my grandfather had come in and sat down beside me, and I couldn't see him, but I could hear him a couple times from another, and my father and my stepmother and my stepdad had all came in. I recognized their voices, but I couldn't see them. And then all on top of this, as I'm going through this, and my poor husband is coming to see me every single day, I ended up having amnesia so bad that I was aware I had a husband, but I didn't know who my husband was, and he was standing right in the room with me. I kept telling him that no, you're not David, you're not my husband, my husband's not here. And he would tell me, no, I'm your husband. And I would tell him, no, you're not my husband. So that was quite trying and upsetting for him. So as the days went on, in my head, it was processing that I was talking, no problem, just like I'm talking to you right now. But actually, how I was coming out in an audible sense was every word was stopped with between a 5 to 10 second pause in between. So it was more like, hi, how are you? And it went on like that for a few days. Although I thought I was talking just like I am now. So while you are a heart patient, they provide, this is the funny part of this, is they provide you with a red heart column. It has like a heart image on the back of it, and the other side has like, some of the foundations that help provide it. I went through 7. So between either dropping them on the floor, getting sick on them, pulling one of my drainage tubes out and trigger warning, covering it in blood because one of my tubes had come out. Well, lo and behold, I went through 7 of these damn pillows. So that was the funny thing about it. So anyway, once I had finally got around being able to see properly, see enough, they managed to try to get me out of bed. Well, they actually got me out of bed that same night that I got out of surgery, which is very trying because, of course, like I said, I was blind and I couldn't see anything. So they're trying to direct me out to the hallway to get me to walk in a different kind of walker so I can get out to the scale. Because, of course, when you go through the heart lung machine, it causes your body to swell. So they needed to make sure that I wasn't like overswelling and what they needed to do to help me with my swelling. So I had to get weighed. And I would tell you right now, having open heart surgery, there is nothing graceful, good, or elegant. It is very painful. Even on the medications that you're on, it is extremely painful. Um, so once about 3 days was over, so Friday around Sunday is when I first started being able to see again. And when I woke up on Sunday evening, 2 good friends of mine were actually at the bottom of the bed waiting for me to wake up and just kind of chilling in the room with me, and they were who I got to see. They were the first ones I actually got to see in 3 days. Literally because I was in that blind mode. I was still kind of blurry, but I could see them. But I was still having a hard time talking. So, all on top of this, my lung collapsed as well. So, they then had to fix my lung. They had to worry about my heart. Everything else like this. So, again, at 28 years old, this is the kind of stuff you don't expect to go through. So, I was in there for a week. I wouldn't let them keep me any longer than a week. I was being a stubborn ass. Most people that know me know I will be. So I then went home and they had a bed set up for me in the living room, and that's where I stayed for the rest of my recovery period. But again, it wasn't a very graceful thing. I wasn't allowed to use my arms. I wasn't allowed to pull. I wasn't allowed to push. Nothing. I had to get somebody to help move me, someone to help me get up, and basically everything like that. So it was a very difficult process. So now we are going on. June this year will be 5 years since I've had my open heart surgery. And let alone, I can't say that my energy is always still the best because, I have other things that are going on that drains the energy. But I haven't had any major issues with my heart or any major chest pain. which is a really good thing. They said later in life I might need to do something better. Otherwise, this is the last thing I'm going to have to do for getting open heart surgery. So that's a really good thing. So I wanted to kind of give you guys a point of view of what it was like for me, being the one that dealt with heart surgery. So yeah, I think that's basically the basis of my video. I'm gonna leave my comments open, so if anyone else has any other questions, I'll gladly be able to answer them for you based on like any procedure names or anything else about like my direct healing process if they wanted to ask it, and go from there. But I really hope you guys enjoyed my point of view of what it was like to go through open heart surgery, and I'm gonna continue uploading videos when I can. I do have a couple new ideas for the craft with me. We're going to do some fabric flower hair ties. And we already did scrunchies. So we're going to do, the fabric hair ties. And then I have a few other ideas, but I'm not going to give them away. So we got to wait for those to get here. But yeah. So I hope you guys like this newest installment of Mommy Needs a Minute. And I will talk to you guys all soon. Thanks for listening. Bye.